That's a story we've been staying on, and you can actually find update on it on our website, arise.tv. Now, the first confirmed case of Mpox has been reported in Cross River State. Commissioner for Health Egbe Ayuke disclosed this during a press briefing in Calabar. Arise correspondent Magdalene Eyoma reports.
Commissioner for Health, Dr. Egbe Ayuke, says the Mpox index case was diagnosed and verified by the National Reference Laboratory in Abuja after the patient, a woman from Okoshe, sought care at the Federal Medical Center in Abakaliki, Ebonyi State. He says the patient's travel history is under investigation and the state government is taking steps to prevent an outbreak. The Mpox Emergency Operations Center has been activated and measures such as contact tracing, quarantine and public awareness campaigns are already ongoing. Advisor to the Governor on Health, Dr. Ekpo is to serve as the incident manager of the center.
All of us are aware now that the index case of Mpox, we are currently enlisting the contacts. They are being monitored for symptoms, and if symptoms appear, they'll be managed and isolated at an appropriate center, in this case, the General Hospital Obaluku. We are going beyond that. Every local government area has been sensitized. Our teams are already on board in the 18 local government areas to ensure that cases are diagnosed early enough and then appropriate treatment started. There is a place for vaccine. As you are aware, even though it is a very important step to protect the population, we don't have vaccines yet in Africa. In the health facilities, we should be able to ensure that equipment that protects health workers from infection are available in the various health facilities.
In addition to the immediate response, the state epidemiologist, Inyang Ekpeyong, says long-term strategies are being planned. She says these include monthly financial support for surveillance teams across all LGAs, the establishment of isolation wards in government hospitals, and continued health promotion and advocacy on personal hygiene.
We have several response pillars, beginning from the community informants. Each ward have 10 community informants, and they are well trained to be able to do early detection of all cases. They know the symptoms of all our priority diseases like Mpox, and then if they see it, they quickly call the next officer and report it to the officer. From there, we take sample and send for testing. And each of our health facilities have what we call facility surveillance focal persons to keep them abreast with the current situation in our hand, that is Mpox outbreak.
The Cross River State government assures the public that it is fully committed to controlling and preventing the spread of Mpox in Cross River State. From Calabar, Magdalene Eyoma, Arise News.